So Miss Smith, what I need you to do is scoot on back. Your head's gotta be almost to the end of the bed down here, and I'm gonna double up the pillow where it's actually under your shoulders. That way when you're laying down, your head is hanging over the back of it. It hyperextends your neck where Dr. Kamel can get to it fairly well. All right, so let me just put your information in, Miss Smith, and then we'll go get Dr. Kamel, okay?
So biopsy is a very simple procedure. It takes really a few minutes. Patient will be lying down on the bed. Very important, the position. So as you can see, her head is on the bed while the shoulders and the neck is under the pillow. See how the neck is very exposed, very extended. I can work in this area very easily. So the first thing we do, we use alcohol to clean the skin. So this is alcohol, and we clean the skin very well. The good thing is that when we do this biopsy, we do not access any blood vessels. So there is no risk of going into any blood vessel or anything like that. We just basically go under the skin and take a sample from the thyroid gland. So we do cleaning very well. I try to use alcohol. Sometimes we use betadine, but some patients have allergy to betadine, so I use alcohol more. Okay. And then the next step is that we put gel on the neck. This is the ultrasound gel, so we can see the nodule on the screen. First thing we do is that we take a look at the thyroid, and we can clearly and precisely identify the nodule. We can see the nodule, and we can see where the needle is going all the way to the nodule, so we make sure 100% that the specimen is taken from the nodule that we want to take the specimen from. So the possibility of error is almost zero with this procedure. The first thing we do after that, we numb the skin. We use lidocaine 2%. We do not use epinephrine, so there is no fear of any heart palpitations or heart racing or anything like that. The procedure is very simple and non-bloody. Patients may lose 1 drop of blood, if any. So very tiny stick. This needle is so small that most patients don't even feel it, or if they feel it, they feel more of the lidocaine going through the skin. Sometimes lidocaine can cause some stinging or burning when we push it to some patients. Then after that, we use this device to take the sample. This device allows us to aim directly into the nodule with one hand, with just one hand. So one hand shows me the nodule, and then the other hand will be right into the nodule. We can see the needle all the way to the nodule, and then with one click, the sample is aspirated into the syringe. After that, we use this cytolite tube to put the sample in, and then send this to the pathologist. And that's all. The procedure is very simple. Patients sometimes have minimal discomfort with this procedure, but should not be severe pain. The numbing medicine usually lasts about an hour. Some patients may feel numb in the neck, may feel numb going all the way to the jaw or the ear. That's normal, completely normal, because the nerve supply can go up to the jaw or the ear. The band-aid can be removed in 10 to 15 minutes. And then we ask the patient not to sit up quickly. Because of the position and the lidocaine, some patients may feel dizzy if you sit them up very fast. So you go very slow, very slow. And then the patient will sit up for a minute and then they're good to go.
The day of your biopsy, we do require a few things before you actually come in for your procedure. We ask that you wear an open neck shirt, that way we have easy access. A V-neck or a loose kind of t-shirt would be okay, just nothing tight around the neck. We also ask that you wear no jewelry and no makeup on your neck. If you forget and come in with jewelry, we will ask that you remove it, and if you forget to not put makeup on your neck, it will be removed with alcohol before we start the procedure. When you come in, you will go to the window and register just as you would normally whenever you check in for an appointment, and then you will get your copay, and then you will have a seat and be waited to call back to the conference room. If you have any questions regarding your copay of your biopsy, please contact our billing department ahead of time, or you may contact your insurance company beforehand. After you've paid your copay, someone will come out and greet you and take you back to our conference room where you will watch a video of the actual biopsy so you know what you're getting into. After you've watched the video of the biopsy, you will be taken into the room to be set up for the actual procedure. You will be seated in a chair to ask if you have any further questions, and then we will place you on the exam table. When you're on the exam table, we ask that you scoot all the way back. That way, whenever you lay down, your head is almost to the end of the bed. The pillow will be doubled up and placed under your shoulders. That way, your head is actually laying over the back of the pillow so that Dr. Kamel has easy access to your neck. Once you're positioned on the exam table, he will then clean your neck with alcohol and then wipe it off and then put some ultrasound gel on there to be used during the ultrasound to see exactly where the nodule is. This is used to see where the nodule is and where the needle is, that way he knows exactly where he's going. He will give you some lidocaine beforehand in the form of a shot to numb your skin. The needles he uses are smaller than the ones they use to draw your blood, and he is very gentle. Once the lidocaine is administered, he will give it 10 seconds or so for your skin to become numb, and then he will stick another syringe in to grab the sample of your nodule. Once we have the sample of your nodule, you will then be cleaned up and a band-aid will be put on your neck and you're free to sit up. We ask that you sit on the bed for a few minutes to make sure you're not dizzy, as sometimes the lidocaine can cause dizziness once you sit up. Once you are not dizzy, you are free to get down and are free to go. After your biopsy is finished, we ask that you make a 2-week follow-up to come in and receive your results, as they cannot be given over the phone. We need you actually in the office, that way the communication is open between you and Dr. Kamel to discuss your plan for further treatment. After your biopsy, there are no restrictions. You may eat and drink and drive and resume life as normal. We just ask that you wear a band-aid for 10 or 15 minutes, just like when you get your blood drawn. The numbness in your neck is localized, so it should not affect your swallowing or your breathing and should only last for an hour or 2 at the most. A little bit of bruising and a little bit of swelling is normal, but if there's anything other than that, we do ask you to come back in. If you would like to see your nodule on the ultrasound screen, we will be happy to show you once your biopsy is complete. We do allow family members to come in the room with you if you would like them in there for support. We do ask, however, that they stay a respectful distance out of the field, that way they don't interfere with the procedure, but they can be there to hold your hand. Once we have the sample from your nodule, it will be sent off to a Ameripath to get the pathology report. If you have a certain preference between you or your insurance company of where it needs to be sent, please let us know several days beforehand so we can arrange to have the proper equipment to get it where it needs to go. On the day of the biopsy, it is technically just reserved for the actual biopsy itself. If you want to discuss labs or symptoms, please save those questions for your actual follow-up appointment, as Dr. Kamel likes to have all the results at once to give you the best plan possible. If you are sick or coughing, have any kind of infection or fever that may interrupt the biopsy, we do ask that you let us know beforehand, as we may need to reschedule depending on how severe your symptoms are. During your biopsy, we do ask that you try to avoid swallowing while the needle is in your neck, but this will only take a few moments. Then you can resume swallowing if necessary.
I was really surprised. I was told that it would feel like a bee sting or like drawing blood. It was less painful than any of it, so it was really a good experience. When I first was told that I had to have a biopsy done, I was a little bit nervous about it. Didn't know really what to expect. But after coming to see Dr. Kamel, it was really a good experience. I appreciated him introducing each little thing that he did. along the way, he asked, "Are you okay?" And that was that. And to me, those are qualities that a caring doctor should have. Put me at ease, and it was over before I realized. It really was a good experience, and if I had to do a referral, someone asked me for a good endocrinologist, hands down, be Dr. Camille.
Well, I came in and they laid me down and they did an ultrasound to see what the cyst looked like, and then from there they did the biopsy and they put some numbing, or a needle that numbed my area, and then they took a needle and withdrew the cells that they needed. It didn't really hurt that bad, just a little pinching. I guess that's how you would describe it. I had a really good experience with the procedure today, and I would recommend Dr. Camille.
How was your experience today?
Well, when I came in, I was really nervous, but after I got in here and we got started, everything, I calmed down. When he gave me the shots, I didn't really feel anything. The only thing I really felt was a little pressure when he was getting the sample for the biopsy. I would recommend Dr. Camille to other patients. He's very nice, very understanding, and I really like him. I really do. He's really a good doctor.
Because I recently had a biopsy done on my thyroid, and I've had them previously done from another doctor, and it was not an experience I liked, but Dr. Camille was by far the best. It was not painful at all. There was no swelling. The recovery time was 5 minutes, and I probably didn't spend 15 minutes in the office total, from the time he started till he finished and got his samples. I would highly recommend Dr. Camille for any biopsy from here on out.
Hi, my name's Samuel. I'm 12 years old. I went to get my biopsies done at Dr. Camille, and after that I went to go eat at Chick-fil-A.
Did it hurt any?
Nope.